Welcome and good morning to everyone. A very happy International Yoga Day to all of you. So, before this session, I was just watching Modi ji live from Kolkata. So, he mentioned a very beautiful phrase, about yoga, about fitness. Why do we do fitness, follow a fitness regime? So, he says, the target shouldn't be weight loss, right? So target of any fitness regime should be the target should be you should be more flexible in your 40s than in you were in 20s. You should be more energetic. The target should be you should be more energetic in 50s than in your 30s, and you should be resistant to lifestyle diseases in your 70s than in your 50s. Such a beautiful thing, isn't it? So many people follow a fitness regime just with a goal in mind. So what I would say is follow a fitness regime, where you should be able to walk energetically for miles together. You should be more flexible. You should be more mobile, and more than that, you should be free from all the various lifestyle diseases. So that should be the aim and goal of your fitness regime. Also follow a balanced, meal or a food routine. Follow a balanced fitness regime. Follow a balanced lifestyle. Okay, so which is and yoga just does just that. It brings in a balance and stability in your life. So with that note, so today's session is all about keeping your body flexible, mobile all the time. Like I said in my previous post, yoga should not be just one day affair, right? It should be followed on all 365 days. So today's session, the first few minutes, say 15-20 minutes, I'm going to show some asanas which are like very simple and easy, which can be followed on a daily basis. I'm sure you all will have at least 15-20 minutes, right, to take out from your busy schedule. All it takes is 15-20 minutes of your time. And if you want to make it as a whole package, so with 15-20 minutes of your physical mobility, also introduce 5 minutes of mindfulness and 5 minutes of breathing exercises. So that will take you a very longer time. So we'll get started then. So I have not decided planned for any complicated asanas. The few asanas which will activate your lymphatic system, which will keep your nervous system balanced, okay, and which will keep your hormones in control. Okay, that's what we women want, right? So especially during from menstruation to menopause, so women goes through a different phase or challenges. So these asanas will help you keep your body flexible, and at the same time it takes care of your physical and mental status. Right. So we'll get started after 15-20 minutes. I would request my friend Dr. Preeti, who I know probably for over more than 2 decades now. So I will talk. There is lots to talk about her. It's 30 minutes is not enough. So she is my go-to person, not only me, for my whole family. So we have our contact in emergency calling. So she's there available, anytime, whenever we need her. So she's been a very dear friend of mine for, like I said, more than 2 decades. She's doing a great job as a doctor, as apart from being a doctor by profession. She also believes she's a naturalist, right? She believes in natural things, Ayurveda. So it's a good mix of medical science and Ayurveda. When you speak to Dr. Preeti, and when she starts speaking, you will get to know. And she is also an environmentalist. So she does a lot of work in her. She is from Kumbakonam, a beautiful city of temples. So she is spiritually inclined as well. So she is a very positive mix of person. And the minute I thought today, whom do I invite, she came to my mind. So we'll talk about more about her, and with her, once we finish the asana session. So let's get started then. So if you are standing, please stand wherever you are, or if you're sitting on a chair also, it's absolutely fine. All right. So stand up or sit on your chair wherever you are. We'll first start with body tapping. Okay. So body tapping helps activate your lymphatic system, okay, and it also activates your nervous system, and your blood circulation starts happening. So this has to be done early in the morning as soon as you wake up, okay, so that the lymphatic system gets activated. Okay, stand comfortably first or sit on your chair comfortably and make a cup from your right palm and start tapping the left hand first, from the neck all the way till the left hand, edge of the left hand. Okay, all around your hand. Just tap. Tap your armpit. Armpit is where your lymphatic drainage is. And it also activates your Ida and Pingla Nadi, the veins, the left and the right vein. So it activates that, the sympathetic and the parasympathetic nervous system. Start with the right hand again. Now we finished with left. Do it with right side, armpit. Gentle tap to your neck with the fingertips, okay? Don't tap it too hard with the fingertips. Your chest, side of your chest, under your bust region, the back, stomach, side of your hips, back, thighs, knees. You can do this while you're sitting on the chair as well. Legs. And finally, tap your feet. Okay? Once you tap your whole body, just stand quietly and see the magic happening around your body. You will feel a slight tingling feeling all around your body. So that's your lymphatic drainage. All right? So morning, as soon as you wake up, sometimes you feel lazy. So try to do this body tapping, the whole body. You can tap your whole body and just stand quietly and take a couple of deep breaths in and out. Okay. So once you do this, the next one is, the next three asanas is Tadasan, Tireka Tadasan and Kati Chakrasan. Okay. I feel this asana should be or should also be done in the mornings. This helps in digestion, and the most important thing for all of us women, right? Or it can be male as well. The spine. It takes care of your spine and the vertebrae attached to the spine. So stand straight and interlock your hands. Interlock your hands. Rest the back of the palms over the head. Keep looking straight. Now breathing in, go up. Stretch your hands up. Breathe out, down. Breathe in, up. Breathe out, down. Breathe in, up. Breathe out, down. Breathe in, up. Breathe out, down. So the last round, just stay up with your heels up, hands up, and stay here for 5 to 10 counts on how much ever you can. 5, 4, 3, 2, 1. Relax your hands. Drop your hands down. Yeah, for those who are not used to it, you might have slight pain in your shoulders and hands, but believe me, perfectly fine. If you can't do 10 rounds, do 5 rounds, do 7 rounds, how much ever you're comfortable. Second one, Tireka Tadasan, separate your legs, interlock your hands. Again, stretch the hands over the head. So these are for the vertebrae, the spinal column next to your spine. So stretch your hands straight. Do not bend your hips like this. Okay, this is only for your upper body, upper back. So take a deep breath in when you're in the center. Breathe out. Bend only from your waist up, not from your hip. Breathe in, center. breathe out, bend to your left. Breathe in center, breathe out right. Breathe in center, breathe out left. Breathe in center, breathe out right. Breathe in center, breathe out left. Breathe in center, breathe out right and stay there. 5, 4, 3, 2, 1. Center, breathe out left. 5, 4, 3, 2, 1. Center, relax your hands. Even this, do it 5 times, 7 times or 10 times, how much ever you're comfortable. The next one is for the facet joint of your back. So there is a joint at the end of your spine which allows you for twisting your body. So this helps in that. So stretch your hands in line with the shoulders. Again, twist only from the upper body. Center, don't twist the hips left and wrap your arms around your body. Center, right. Center, left. Center, right. Center, left. Center, right. Center, left. Center, right. Center, left. Center, right, and stay here. 5, 4, 3, 2, 1. Center, twist left. Stay. 5, 4, 3, 2, 1. Center, relax. Okay. Now get your chair. If you have a chair, just bring your chair. I'll show some exercises on the chair. So you're sitting on your couch watching TV, or you have some work, so you're sitting on your office desk. So just sit on the chair. Okay, just sit on the chair with your spine upright. With your spine upright, and just stretch your right leg straight forward and relax. Left leg up and relax. So do this every time you're sitting down for a longer time. There are some sessions where you'll have to sit for hours together, or there are some office calls, or you're just sitting and watching a movie. So keep moving your legs. Okay, mobility is the main thing for fit body, right? You have to keep moving your legs. Relax, up and hold now. Flex your toes back and hold. 5, 4, 3, 2, 1. Relax. Again, stretch. 5, 4, 3, 2, 1. Relax. Okay, now come towards the edge of the chair. Forward bend. So, like I said, everything can be done either standing or sitting or lying down. Okay, all you have to do is move your body. Forward bend. Breathing in, raise your hands up. Breathe out, bend forward. Breathe in, again up. Breathe out, forward. Breathe in, up. Breathe out, forward, and stay here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Breathe in, up. Breathe out, relax. Okay, now side bends. Just separate your knees. Separate your knees. Right elbow will go on the right thigh. Breathing in, just bend towards, breathing out, bend towards your right. Come back. Now, left elbow on the left thigh, bend towards your left. Center. Again, bend towards your right. Center. Bend towards your left. Center. Bend towards your right. Stay there. 5, 4, 3, 2, 1. Center. Bend towards your left. Hold. 5, 4, 3, 2, 1. Center. Now, for your spine mobility, right? So just sit upright, sit straight. This is cat and cow pose on the chair. Like I said, you can do it on the floor as well. Today, I'm not sure if you can watch me if I go down. So I'm going to show all this sitting on the chair. So you can do this sitting on your office desk or at home as well. Okay. Now just slouch your back, round your spine, and shrug your shoulders and arch your back. Look up. Just round your spine and arch your back. Round your spine and arch your back. Round your spine and arch your back. Okay, do this 10 to 20 times if you feel comfortable. Okay, the other thing is standing asanas with the help of chair. Okay, just keep a chair in front of you. Okay, first we'll start with toe tapping. Okay, so just go on the chair, tap on the chair and move your hands as well. Do this about 50 times every day, which will make your legs toned and also it will make your legs flexible. So just tap the toes. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay. Do this for 50 times every day. Alright. The next one which can be done is stretch your hands forward. Just touch your base to the chair and stand up. Touch your base to the chair and stand. Touch and up. 4, 5, 6, 7, 8, 9, 10. Okay. Do this about 20 to 30 times. Alright. So these are some exercises which you don't have to dedicate a time for it. So if you see, we done with all the exercise which can be done on a daily basis in 15 minutes, right? So apart from all these exercises, it is also good to do a simple breathing technique. All right. So many of us are under stress many a times, right? Most of the time during the day, we are stressed for some or the other things, right? So there is a breathing technique which will instantly calm your nervous system. All right. So what you need to do is just breathe in through your nostrils on the count of 5. Make a pout and breathe out from your mouth. Okay. I will demonstrate now. Breathe in through the nostrils. Breathe out through the mouth. Breathe in through the nostrils on the count of 5. Breathe out through the mouth. Breathe in through the nostrils. Breathe out through the mouth. Okay, so this can be done for 30 seconds. And the next one is yogic breath. Okay, what do you mean by yogic breath? Where you're visualizing when you breathe in, you expand your stomach, you expand your chest and the shoulders. When you breathe out, relax your shoulders, relax your chest and the stomach. Okay, so that is full yogic breath where you're using all the 3 lobes of your lungs. Okay, so sit with your palms upright, or you can also keep right palm on the stomach, left palm on your chest. So inhale, expand the stomach, expand the chest and the collarbone. Exhale, relax the shoulders, relax the chest and relax your stomach. Inhale, expand the stomach, expand the chest and the shoulders. Exhale, relax the shoulders, relax the chest and the stomach. Okay, do this at least for 1 minute. So what it does is it balances your sympathetic and parasympathetic nervous system, that's your Ida and Pingla Nadi, and also calms your nervous system. Okay, so this can be done. And the other one is Anulom Vilom, an alternate nostril breathing, a simple alternate nostril breathing for 1 minute. Okay. So, however you're comfortable with the hands, I'm comfortable with keeping the index finger and the middle finger at the middle of the eyebrows, or some are comfortable this way. Okay. This is also fine. However, you're comfortable doing it, do it. Okay. So, index finger and the middle finger at the middle of the eyebrows. This is to activate the Agya Chakra, your third eye. That's when I keep my two fingers here and your mind is focused at the eyebrow center. Okay. So, close the right nostril. Inhale as much as you're comfortable, as per your capacity. Close the left nostril, open the right, exhale through the right. Inhale through the right. Close the right nostril, exhale through the left. Again, inhale through the left. Close the left nostril, exhale through the right. Okay, so do this for 1 minute. If any of your nostrils are blocked and you're not able to breathe properly, so what I would suggest is just sit quietly and visualize that breath is going in through the left nostril, breath is flowing through the right nostril. Again, breathe in, visualize breathing in through the right nostril, breathing out through the left nostril. Okay. But if the block is temporary due to some reasons, you have slept for towards one side for a long time, then what you can do is, if the right nostril is blocked, make a fist and press the left armpit. Okay. If the right nostril is blocked, press the opposite armpit. That's the left armpit. Stay here for a minute. You will see that the channels, the blockages are slowly opening up. If your left nostril is blocked, press the right armpit and hold it for 1 minute. And release. If both the nostrils are blocked, then press both the armpits and stay here. You can also lie down on one side, whichever side the nostril is blocked. So that nostril has to be up and you can lie down. Again, if the right nostril is blocked, make sure the right nostril is up and you can lie down with the head rested on a hand. The head should be slightly elevated. So this you can do. And the last one, which I think each one of us should do, is Bhramari Pranayama, the humming bee sound. Okay, there are some medical, researches also, which shows that it calms your nervous system instantly. You become a more calmer person. So that is simple. Usually it is done with Shanmukhi Asana, that is closing all the points, or it's called all the randhras in your face. But this can be done simply also. Just relax your elbows, plug your ears in. So there is the tiny muscle outside your ear. Just plug that in. Take a deep breath in. Make a humming sound. So this also has to be done for 1 minute. Or if you don't have time, just 5 rounds is more than enough. Just close your ears. Hum. Again, breathe in. And while breathing out, hum. Okay, so do this for 1 minute or 5 to 10 times, however you're comfortable. Okay, so these were some asanas which you can do on a regular basis. There are lots of other asanas too, like, for Shashankasana, the child pose. Sitting down with the hands stretched forward, you can do that as well. Bhujangasana is very good. Cobra pose, you can do that as well. So there are lots of asanas which will help you on day-to-day basis. Okay, so that was few simple asanas which I feel everyone can do it. Okay, so take some time out, at least 15-20 minutes, and make sure you do these few asanas which will keep your whole body flexible, and also take some time out for breathing. Okay. Now we log off and log in. Questions on asanas, any specific asanas you want to know for any of your issues, you can type a question here and I will try to answer those questions. And so you can, post your questions here on asanas specifically. I am not a professional, to answer on medical things. So that Dr. Preeti will take care. So any questions on the asanas, any specific issues you have, you can type in here and post your questions. Okay, so a simple routine. So even for if you don't have time for anything else, just do 5 rounds of Surya Namaskar, right? So 5 rounds of Surya Namaskar on the floor. You can do it on the floor. You can do it with a chair, right? So there are some videos on my page where I have shown how to do Surya Namaskar on the chair, how to do Surya Namaskar, on the floor. So, inviting Preeti. Hello, Dr. Preeti. We have
Hi,
Dr. Preeti back. For a
I'm
minute, I was
sorry.
like, my stress levels went up. Dr.
I,
Preeti.
I'm sorry. I mean, I'm new to Insta, so
Yeah, I know, I get it. No, no worries at all. I'm new. I'm not new to Insta, but I'm new to live session. So for me also, I took a while to actually understand how to remove you and then add you back. Okay, anyways, no issue. So we'll get
thank
going.
you. Thank you so much. Sorry for the technical hitch.
No
And
worries.
first of all, wish you all a very happy Yoga Day. And thank you, Rohini, for inviting me over. And I am also starting a healthy beginning today with all of you. So it was wonderful to see the and do the stretch after a long time. And the only comment is that stretchability is a must at whatever age you are. And as you said, 15 minutes from 24 hours is something that we can easily take out.
Yeah.
Uh, Thanks for initiating it today.
Thank you, Dr. Preeti. So, as much as you're excited and you're happy to be back, I'm happy that I was able to reach out to you, and you could take out some time from your busy schedule, right? Dr. Preeti is like completely occupied from 6 in the morning till the night, 11. Like last night, she came back from a hospital at 11 o'clock, but still she reached out to me about today's session. So that's the dedication that Dr. Preeti brings in. So she used to practice with me, but now because of some schedule issues, she's not able to join us. But yeah, so let's get started with the questions. We'll wait for few seconds if someone has. All right. Okay, so like I said, today's session is about from menstruation to menopause. Why I chose only women is so women plays different kinds of roles, right? And we have different phases, unlike men. So women have different phases in life. First, starting with menstruation, then starting with pregnancy, post-pregnancy, perimenopause, menopause. Like there are different phases, and there are so many challenges for us. So that's the reason I chose women, and I do my yoga session for women specifically than men, because male, they are naturally they are active, right? So but women are not, so we get into a lot of other priorities and we forget about ourselves. Starting with the first question, Dr. Preeti, for you, and you may add a little bit more from menstruation. So, how do teens, or it can be us as well? So, before the menstruation cycle even starts, personally for me, the PMS starts 1 week before my actual period starts. So, how do we manage those symptoms? Does no food intake, and I have a lot of cravings before my cycle starts. And for that matter, the frustration or the irritability also increases. We see a lot in teenagers as well. The period cramps. So, is there any tip or any lifestyle hacks that we can do during that period?
You're absolutely right, Noini. See, as we all know that we have two hormones working on our body, and the first 15 days and last 15 days, when there's a shift in the hormone and there's a peak in the progesterone, it's very natural to be bloated, to have digestive issues, to have mood swings, to have edemas all over the body. So this can be tackled by a healthy lifestyle, obviously. But the last 1 week, just before the periods happen, the progesterone is at the max peak. So, progesterone is a hormone which is trying to help you to get pregnant. So, this hormone is going to safeguard the reproductive system by getting fluid all around it. So, this is a very natural phenomenon. It is not anything abnormal. But nowadays, that we're not able to take the rest and all of us are running around all the time. So, the main thing that we can concentrate on is on diet and some kind of simple stretches. So if you look at diet, we have to have fruits and vegetables which will help you to excrete water, like diuretics. Medicine is only when you have to have, like, a situation where it is out of control, like certain people have too much of breast pain, or the mood swings goes too random that the family is not able to tackle. So in such conditions, we do have supplements itself that we ask to be prescribed and consumed. But otherwise, making a diet which is free of oily foods, masala items, having diuretic diet like barley, lauki, and pumpkin, green pumpkin, all these will actually excrete the excess fluid from your body and so make you feel lighter. And lighter exercises. So we shouldn't strain the body that much. So lighter stretches and lighter exercises, even swimming, can actually ease out the discomfort during that time. The most important would be to divert the mind, because you already know that your period is expecting, so you're already in a mental setup where you're thinking that you're going to get these PMS symptoms. So you will be more aligned towards experiencing them when you are actually thinking about it. So diverting the mind to do more positive stuff like artwork, or maybe engaging in garden or some nature activity will actually help you to ease it out even better. Symptoms like nodularity in the breast, or when you have foul smelling discharge during that last one
Yes.
week, then you have to take some medical treatment for it. But the rest of it can be managed by just diet and exercise.
All right, awesome. So you also mentioned that do lighter exercise, when you're going through the PMS. During menstruation, with that, I had a question because many of my students, they don't, they continue their fitness regime even during menstruation. I always have that question. How can some people manage it and some people, they just need that 3 days rest? So from medical background, so what do you suggest women should they continue their fitness regime even during menstruation cycle?
It very much is individualistic. The fact is that people have different pain thresholds. So any threshold for that matter of fact. So people who have better threshold will be able to sustain. If you're able to do without any crampy discomfort and without any lightheadedness, then there is no stopping at all. Only if you are feeling that your stamina is low, or probably your cramps increases with exercise, then it's better you stop. Actually, during pregnancy also it's the same
Yeah.
thing. Now dancers and regular yoga people, we don't ask
Yes.
them to stop any of it during their pregnancy.
Yeah.
Except otherwise, in the scan we find anything abnormal, then there is a restriction, but there's no stopping as such.
Very true. And I'm getting more inquiries these days from pregnant women, and it's very good to see that doctors are actually, prescribing, pregnant women to start with yoga. So when I went through the prenatal and postnatal pregnancy, it's advisable to start yoga after 4 months, but most of them are okay to start from the first trimester itself.
Yeah.
So yeah, and it's very important to, and there are certain asanas for different trimester. Even during menstruation, I remember when I was doing my certification, inversions are a no-no. So
Okay.
you should not do the head down and the legs up. So apart from that, all the asanas can be done during menstruation. Like Dr. Preeti said, it depends on different individuals. Okay. So on the menstruation, so we'll keep taking questions in between. Moving on to pregnancy, Dr. Preeti.
Okay.
So I have many of my friends, who are planning for a family. Some find it difficult, and for some it's easy, right? So what do you? So when do couples start planning? Is there any like they say, right? In olden days, they used to say that once you're married, get done with the babies. And for a few things, I feel that's true, but as for you, what is the right gap you think should be there after marriage, and when should they start planning? And if they start planning, is mental planning and physical planning should be there from both husband and wife? It should, like I when I interact with my student, I say equal engagement should be there from the husband as well. So both the partners should be mentally prepared and physically prepared for pregnancy. So what is your advice for people between 25 to 35 years of age if they planning for pregnancy, Dr.
Okay.
Preeti?
So, as we are all aware, all our bones and structures inside the body continue to grow until 21 to 22 years of age. So, including our uterus, just like how externally you see growth happening in the body, internally also the organs are changing their shape and size and position. So, generally, around 22 years, the reproductive system gains full maturity. So, the most fertile period for a female is between 23 to 27 years of age. But
Okay.
we all know these days nobody gets married in that age.
Yes, very true.
So the fertile age is actually kind of overshot, and nowadays we see people marrying around 30 years of age.
Yeah.
So that is why a lot of infertility issues have propped up in the recent times.
Yeah.
Uh, in this age and time, we can see both male and females, they want to know their partners well before they commit into making a family. So that easily can take a year or maybe 1 or 2 years plus for them to get that rapport, whether they are mature enough to raise a child.
Yeah.
In today's age and time where people are having fewer children, they are kind of apprehensive and over plan for a pregnancy. As you said, like in olden times, when I started practice around 25 years back, I saw that young girls who came pregnant, like 23, 24, they handled pregnancy very easily because they were unbiased in their head, and the whole process was quite simple. But these days, with the amount of investigations and a lot of doctor visits, there's a lot of confusion which is happening in the minds of youngsters that they don't want to commit to so much of stress. They feel that pregnancy itself is a stress. So they
Yeah.
keep on postponing. But see, our body has a rhythm inside, and we have that many eggs only. Everybody at birth itself, we are fixed. The girls are fixed with the number of eggs that they have. This is a genetic predicament. So, when you have this many fixed eggs and you are shedding eggs every month, as we age, the quality of eggs is going to reduce. So it's a natural thing that as we age, the fertility rate will come down, and because the quality of the egg is also low. Sometimes a lot of people experience something called as an anembryonic gestation, where the baby forms without a heartbeat, or the baby forms at abnormal spaces in the reproductive space. This is all because the ovary did not release a good egg. So, what I would suggest is, irrespective of the age group, when you start for a pregnancy, being in India, we are kind of prone for diabetes. In India, we all know that we're the diabetic capital of the world. So, the first evaluation should be for sugar, and the next one for anemic status. Though we are all eating well these days, the amount of nourishment which is going in our diet seems to be very reduced. So anemia, even though it's not surfacing, if you check and see, most of the girls are on the anemic profile. So these are two things that basically a girl should check and see. If there is a family history of any hormonal imbalances like thyroid, then that is another requirement. So these are three basic medical checkups that you need to take before planning a pregnancy. And the most important thing is pregnancy is going to make you put on around 10 to 15 kgs of weight. So a good body mass index, a BMI below 22 is an absolute must before we start pregnancy, because weight is what produces all the problems during gestation. So, keeping a good diet and an exercise regime is very essential before somebody wants to plan a pregnancy.
Yeah.
And if there are irregularities in your menstrual cycle, or if you have a family history whereas there's a delayed conception, sometimes they say my mom conceived 8 years after marriage.
Yeah.
Some patients come up with such kind of histories. So when there are such histories, there are certain specialty tests that we take for the hormones to just know whether there's any kind of imbalance. So these are the main things that we have to see for girls. For men also, see, we know that the chromosomes are an equal distribution. So 46 from both sides has to come, and we cannot say that only women have to be in the healthier profile.
Yeah.
So men also have to drop their habits, especially smoking and drinking needs to be stopped, because these are genetically imprinted in the gene. So when we sometimes say the child can also develop a smoking habit, it is because the parent was smoking before the pregnancy was planned. So certain habits need to be stopped. Of course, the body mass index should be below 22. And if there is any genetic diseases running in the family, like asthma or thyroid, these should be assessed for men before they get into the pregnancy mode. Regarding supplements for women, we recommend folic acid at 5 milligram once a day, because folic acid prevents certain neurological defects which cannot be prevented by diet or exercise. So this is like a compulsory thing now and has been proven for more than 30 years. Folic acid is a recommended prenatal supplement for at least 2 to 3 months before anybody plans a pregnancy.
All right. Okay, so that was a good discussion on the towards the pregnancy, Dr. Preeti. So again, what are those three tests you asked to take if you're planning for pregnancy? An anemic test was
Yes,
one. The second one,
thyroid and
thyroid, PCOD, PCOS.
yes, and
Okay,
sugar,
sugar. Okay, all right.
ACT.
All right. Okay. Okay, so moving on with so if we do not have any questions on pregnancy, we'll move on to post-pregnancy. And I already have a question here. So we'll start with that. So post-pregnancy again brings in a lot of challenges because your body, the whole body goes through a lot of changes. So one how to have better bladder control, especially post-pregnancy. Right? I do get a lot of questions here from my students as well. So where the pelvic muscle is all loosened up. So so I will let Dr. Preeti, just throw some light on this question.
Sure, it's a very important question actually, and the most looked down upon muscle is the pelvic structures. But actually speaking, they do most of the work in our body. There's like a diaphragm holding all the stuff which is above in your abdomen. Unfortunately, the Indian genetic build-up is such that the abdominal and the pelvic strength is not so great.
Yeah.
So we have to put extra effort in developing those muscles, especially during pregnancy when there is so much of bearing down upon the pelvic structures. The weight itself, the weight of the baby, the uterus, the placenta, that itself, it kind of damages a lot of pelvic structures. So generally what happens is pregnant women come after 7 to 8 months of period to ask whether they can start with pelvic floor exercises.
Mm-hmm.
Genuinely, it should be done at all age groups, irrespective of being pregnant or not. It should be actually
Yes.
started probably in teenage itself,
Yeah.
because your pelvic structures is not just your uterus, it's your bladder and your bowel also.
Mm-hmm.
See, now the bladder problem happens because sometimes there might be suturing in the lower side during a delivery, or maybe if the baby's weight was heavy and during the bearing down, the bladder descended, there might be loss of bladder wall strength. So this is the main reason that people come in for urogynecological problems, saying that there's dribbling of urine, or when they do activities where they jump, or they have to
Sneeze.
yeah, sneeze. So there's increased abdominal pressure. There is dribbling. So this is actually becoming a ethical problem itself. They do not like it, and there is a smell around it, so they feel disgusted. So what I would suggest is pelvic floor exercises first of all should be done at all age groups. If it's post pregnancy, depending whether it's a cesarean delivery or a normal delivery, on the rate of healing, the exercise should be started a month to 1.5 months post delivery, because that is the time. 40 days is the time for the uterus to contract after delivery. So now people have this habit of tying abdominal binders postnatally. Abdominal binders will just give you strength to hold the abdomen in. Just a loosened skin will be held together. The muscle will not mold itself by just a belt. So active exercise to both the abdomen, back, as well as the pelvic structures. All these three together, if you align and do, then the structures will start to form. But it is going to take some time. It's not going to happen overnight. And with a young infant in hand, you can only dedicate probably 5 to 10 minutes every day. So breathing exercises with some amount of strengthening for the first 6 months, along with walking, at least 15 to 20 minutes of walking. This will help you to first develop those muscles. But if you continuously do it for the next 1 year, you will get back the same strength that you had pre-pregnancy. But if a lot of people, what they do is they don't find time. They When they have an infant in hand, they say I don't find time, and they postpone it. Maybe after a year or year and a half, the muscles have become even more lax. So that time when they have to exercise, they have to put even more energy and stamina into it to develop those muscles. So the earlier the better, and consistency is the core. Wearing those tampons, or anything insertive doesn't harm. It is just a hygiene issue over there. That one we have to just be sure that a proper company stuff is used and the hygiene part is taken care of. But for the bladder descent, exercise is the only way to improve it.
All right.
Was it
Yeah, there are various exercises for pelvic floor muscle. Can swear by is the Kegel exercises, or in Yogasana, it's called Setu Bandhasan or Kandharasana, where you lift your hips up and squeeze the glutes, squeeze
Yeah.
your glutes and the pelvic floor muscle. Hold
Yes.
it and then release, holding the pelvic floor muscle and releasing. And to tighten your abdomen, there is Falakasana, straight arm plank, forearm planks. So all those will help. And like Dr. Preeti said, be consistent in your exercises. It takes minimum 6 months to 1 year to build that muscles back, because there's so many changes happened in your body. With that, I come to the next question. Post pregnancy, Dr. Preeti,
Yeah.
what is the right time post pregnancy, post delivery, that a woman should get back to her physical fitness?
So as I said, 40 days is a time that the uterus involutes completely.
Okay.
If it is a normal delivery, the person starts to feel fine by 1 month of time itself. So,
Okay.
because for the first 1 month, there is a lot of change in their lifestyle, their eating, sleeping pattern, everything has changed. For
Yeah.
them to dedicate themselves to exercise becomes difficult. So, the first 1 month, we suggest to do just breathing exercises. And after a month, depending upon the uterine inversion, to go ahead and start doing regular exercise, whatever they are used to prior. So starting something new in the early stages is not what is recommended. So
Recommended. Okay.
we generally ask people to start around 7 months of age itself, whatever they want to do,
Mhm.
whether it's physiotherapy or yoga or
Mhm.
swimming, to start
Mhm.
at 7 months after the scan, and to continue the same, what they have already accustomed to start the same, even if it is for a short duration. It's okay, but they can start it off. For cesarean, post cesarean deliveries, there might be a little bit more discomfort. The
Mhm.
suture healing might take a little more time. So,
Mhm.
45 days when the baby goes for the first vaccination, that will be a pretty comfortable time to start, because you would have also gone for a consultation and they would have seen how your suture is healed.
Yeah.
So, after the 45th day is a safer time to start for post cesarean people.
Okay.
And except otherwise there has been a wound infection and we are waiting for healing, then they can be delayed up to 60 days.
All right. Thank you. Payal says thanks, Dr. Preeti. So you
Welcome.
answered her question. Okay, moving on to the next set of questions. The most important phase of our lives, perimenopause and menopause, right? So most of us, I think, who are online now are going through this phase, of life. Either we are in perimenopause or menopause, right? So, what age do you think, Dr. Preeti, the perimenopause phase starts until? How many years does it extend until we actually hit the menopause phase?
Yes. So now the word peep, like everybody says peep,
Yeah.
nobody wants to use the word perimenopause. They find it very old and
Okay,
haggy.
I didn't know about that, Dr. Preeti. Thank you for letting me know.
So yeah, that is seems to be a big issue these days. The more than the women, the family comes to complain
Yeah.
that they're unable to tolerate the mood swings and they do not know how to deal with such issues. But again, as I said in the beginning, it's to do with the mind. So the more that you start thinking that you're on the perimenopausal, the word, so you
Yes.
start to align all your symptoms towards it.
Very true.
It's a very natural process, just like how the menarche happens at 12 to 16 years of age, how the menarche happens. Even at that time, those symptoms would have been there. As a child, we were busy playing and we never paid attention to it. So we just overlooked it and we attained age and we came through it. But now, with all the 20, 25 years of experience, now we know that we are hitting a period, and so we start to analyze too much. So the
Yes.
first fact is have a general knowledge, like in your mom, your sisters, your aunts, at what age they hit menopause will be plus or minus 2 years in what you'll also follow through. So just as your body is going to be preparing for a stage where there is going to be loss of calcium from the body, there's going to be accumulation of cholesterol into the body, and there's going to be a fall in the hormones, and the male hormones are going to increase in the body. So the estrogen is going to go down, and the testosterone is going to increase. So testosterone is a male hormone which actually produces masculinity, so it
Oh.
reduces your femininity. So the curves which were all there is going to fill up.
Okay.
And the hairline is going to regress and unwanted hair growth is going to happen. There's going to be some amount of pigmentation. And even, the skin freckles and the wrinkles, all this is because of the hormonal setup which is happening naturally inside the body. So these things can be avoided first thing by exercise, because your hormones are all fat based. Both estrogen as well as testosterone is both fat based production. So when you have this excess fat, because in women every decade it adds a few kgs to your normal baseline weight.
Mm-hmm.
At 20 years, 30 years, 40 years, 50 years, it adds few kgs, 2 3 kgs plus or minus it happens. So this is because the body is naturally preparing for that phase.
Mm-hmm.
If you want to break that, the only way that you can do is by a triangle. You have to have a proper diet, exercise, and rest. So the three corners are this only. If you diet and you exercise and your sleep is not good, that is also going to affect your hormonal profile. And this doesn't happen suddenly at 40, 50 years. This is actually, the onset is happening at 20 years itself. So it's kind of a system that you develop, the discipline that you develop, because these days we find people working through the night,
Yeah.
and the biorhythm inside your body is not fixed for that. When you close your eyes at night, when it is dark, is when the reproductive hormones start to function. And when you open your eyes in the morning and see the sun's rays, natural sun's rays, is when your thyroid starts to function. Now, this system is already preset inside the body. When we are using artificial illuminated devices like our gadgets and we stay late awake into the night, so you're already disrupting your hormones for a quite long period of time. So
Okay.
when for 10, 20 years you've already been disrupting the hormones, when you reach the perimenopausal time, the hormonal imbalance is so much that you start to feel symptoms. So I would suggest the youngsters have a disciplined lifestyle. I understand that a lot of us are doing night work, and we our habit has moved in later into the night. But then try to restrict it as much as possible. Sleeping during the day is actually, youngsters can manage it up very easily. If you speak to a 20 to 30-year-old, they will have no issues at all. They'll say, I'm able to sleep in the day, and night I'm very fresh, I'm able to study and everything, they will say.
Mm.
But then at 40 to 45 years, they will be able to see that pinch.
Yeah.
So first thing is, where possible, you try to correct it. And if you don't opt for very long night shifts, like for 2, 3 months, if you're a night, and then you can again change back to a day shift, and then again you go back to night shift, that will be better.
Mm.
That is number one. And secondly, these cholesterol issues that I told you that happens during perimenopause,
Mm-hmm.
that produces more life-threatening problems. Like in the heart and in the brain, it produces more issues that can deal with your old age.
Mm.
So when we say about cardiac cholesterol issues, atherosclerosis and angio and everything, it is not the fat that got deposited after you became 40 years. It is something that happened much earlier. So from your 30 years itself, from what you've been eating, because everybody says, I'm young now, I have to eat. So
Yeah.
that is totally acceptable, but eat the right food. See, junk
Mm.
food, if it is not avoidable, keep it rare.
Mm.
And the process happens from an early time. The cholesterol gets deposited from early time. The symptoms start to appear much later. So committing to a healthy diet from an earlier age itself is very important.
Yeah.
And finally, exercise. So exercise is something, should be like a daily ritual, like how we brush our teeth every day. Exercise should be there in our blood, and we should do it every day.
Exactly. Yeah.
Depending upon what time you have, you come into what kind of exercise you can do. But then it should be like a daily ritual, and during periods, plus or minus, depending upon the person's threshold, you can or cannot do it. So now, if you have already prepared yourself for the perimenopausal age, then you will be able to handle it really well. Now
Mm.
that we have not prepared ourselves, so this time we have to make sure, like what you said, being flexible,
Mm.
because developing muscle, nowadays people come and ask me whether they can take whey protein and join the gym after 40, 45 years of age. Your muscle was not toned for that. When
Mm.
you suddenly jump in and do zumba and such kind of floor exercises where you're jumping around, your joints will get lax. Just yesterday also, I saw a lady who's in her early 50s and started pickleball just a month back, and yesterday she sprained her ankle.
Oh.
So, what I'm suggesting is, your body was not built to handle that kind of threshold in exercise. So, you have
Mm.
to develop it slowly, and yoga is the best because it doesn't cause injury, and you can do it in the way that you're comfortable in. Whether
Mm.
you're sitting on a chair and doing, or on the floor and doing, depending upon your comfort, you can just, increase, and the flexibility will slowly develop over a period of time. So when the body's flexibility increases, the body's handling of the hormone also improves.
Mm.
So, our aim should be not in reducing weight, but improving the flexibility. So, choose exercises which will improve your flexibility, especially for the 40 years plus. And most importantly, that is the time when lifestyle disorder diseases like diabetes and hypertension start to peep in.
Yeah.
So, keep an eye on that, because your perimenopausal symptoms might be a reflector of something metabolic which is happening.
Mm.
So, more frequent checkups, the basic checkup of sugar and thyroid and anemia, should be done more frequently after this 40 years of age, probably every 6 months once. And reproductive screening using a pap smear is an absolute must, whether you have symptoms or not. So, these will guide you to tell you that there are no secondary infections or secondary metabolic conditions which are predisposing you to developing these symptoms. If there's nothing as such, then like the diuretic diet that I said, which keeps your
Mm.
body light. When you eat deep fried items and masala items, you retain more of water into your body. So you have to have lighter diet. Normal protein from the diet would do. See,
Mm.
our grandparents and our parents never took any of these extra supplements and they didn't become healthy by just taking those supplements. Nowadays, the fad is that we all need supplements.
Yeah.
Unless and until you have any issues per se, like a joint issue or a muscle issue or some family running issue, then a supplement required. Not everybody requires supplement after 45. Just a calcium supplement would do, because osteoporosis is a very demanding problem which
Yeah.
of the old age. But otherwise, people keep coming up with a lot of online products and keep asking whether these kind of products can be taken regularly. My sincere advice would be never to get addicted to any of these products.
Mm.
Just like how we use some facial creams and we say that, my skin doesn't agree to any other cream and I can only use this. Similar thing happens even with prescribed products. So when you start to get addicted to any of these supplements, you'll not be able to live without them.
Yeah.
Whatever said and done, it is also a chemical, it also comes in a packaging, so it is also processed. So
Yeah.
anything processed for a long period of time is not going to give you much health benefit, and there are going to be some risk issues also associated with it. So if you have metabolic conditions like lifestyle diseases, non-communicable diseases like thyroid, asthma, sugar, BP, then you need to take some supplements with your regular medications. If not, medicine is not the requirement. Requirement would be to start building for it from a younger age and to maintain muscle strength by improving flexibility. And
Mhm.
to improve mood swings, meditation, and mental diversion into doing more positive activities would be the only way to handle it. At extreme conditions is where we suggest hormone replacement treatment, HRTs, which are the in thing these days. People ask for implants also to maintain the hormonal profile.
Yes, Dr.
I'm
Preeti.
sorry. Yeah, my
Mm.
time, I guess it was just cutting off. So
Oh,
this
okay.
is this is what I would suggest you to do, Rohini.
All right. So that's a wonderful advice that you gave, Dr. Preeti. So I'm sure most of them who are online now found it very insightful. And with that, we'll end this with the last question on as the theme for Yoga Day is healthy aging. I have been seeing you for more than 20 years now, Dr. Preeti. You've been the same from the time I've seen you 25 years back. You're just the same. So, what is your take on this? How do we maintain and keep up to that healthy aging? Till until the age of 60 or 70 or whatever it is.
You are the reason, I guess, Rohini. You're the
Oh
one
my
who
God!
initiated yoga for me.
Don't say
And you've
that.
been a role model for me. You have also remained the same.
Oh no. Yeah, but there are a few changes that happen naturally. So, like Dr. Preeti said, right? So, just take it as it comes. I think we are losing her. So, there is some network issue, I think. So, like Dr. Preeti said, take the phases as it comes with an open mind and a positive outlook is what I think we can, and try to be happy, positive, and cheerful all the time. It's all about you after 40. What do you say, Dr. Preeti? And the kids and husband, in-laws, my parents can take a back seat once you cross 40. So take care of your health is what I would say. Any closing note, Dr. Preeti? I know your network is also saying, telling you that it's time up. We need to, cut short this discussion. But yeah, so yes, Dr. Preeti.
I'm sorry. It's my son's phone is asking for
Yeah.
time.
No issues. So, any
Yeah.
closing note on this, Dr. Preeti?
Yes. So I am also in my late 40s, and I would suggest that we all prepare for better aging. See, in this futuristic world, we are not going to have much help to take care of us in our old age.
Mhm.
And being mobile is the most important thing that we should commit to as we age. So nowadays we are all in much of stationary jobs where we are sitting down for a very long period of time,
Yeah.
and our body was not built for it. So when we are sitting down for so long, your back muscles are going to go into atrophy,
Mm.
meaning that they're not going to become healthy enough to hold your body after your 60s or 70s. So we are
Mm.
going to have, so nowadays we see even youngsters coming with a lot of back issues, disc prolapse and low back issues. That is
Mm.
all because of our lifestyle right now. So I would suggest to keep walking. Even if you have pain or whatever discomfort, if you have to even sit for a long period, just keep standing in between and keep doing lower workouts. Like your leg is the most important part of your
Yeah.
body. So keep working on your legs whenever, wherever possible. And I wish that our community could always stay healthy and can keep motivating others to also, come into the same ring. And we all have to enjoy this world
Yes.
mobile, smiling, and have
Yes.
lesser medicines and lesser hospital visits. So that would be
Exactly.
my closing note for the day. And thanks so much for all of your patient listening. It has been
Thank
a
you, Dr.
pleasure for
Preeti.
me to be online with all of you, and it was an experience for me too. And I also promise that I'm going to start doing all the stretches that you just showed. I think we can just do this in the bath just before our bath itself, 15 minutes. We can just take off in the bath and do
Yes.
it, our own
Yes.
personal space.
Yes, that's true. That's true.
Yeah,
So, yeah, Dr. Preeti, thank you so much. So, it was a very insightful session, even for me, though I've been in this, fitness space for quite some time. But there are a few things that, it was an eye opener for me as well. So, I hope the audience also liked the discussion. But if you have any other questions, please feel free to drop in a message in my Insta, or if you have my personal phone number, please do drop in, and I will make sure that I will reach out to Dr. Preeti and
absolutely.
get that answer back for you.
So will
All
do.
right, with that note, a very happy International Yoga Day for all of you. Keep moving and keep yourself flexible and fit, most importantly positive and cheerful. All
Yes.
right, thank you,
Thank you.
Dr.
Thank
Preeti.
you.
Thanks everyone for joining
Thank you,
in. Bye bye.
everybody.
Take care.
Bye. Thank
Bye.
you.